everyone, I'm Dr. Tan Yiping, consultant obstetrician and gynecologist. And as usual, we are going to continue with our live video on endometriosis. And as I mentioned earlier, this month, March is Endometriosis Awareness Month. So that is why I'm doing this series of endometriosis endometriosis live videos for the entire month. So today is already session number 6 and we have 2 more to go. And I hope with these 8 sessions, I am able to answer all your questions. Okay, before we start, just to tell you, I think some of you know, I just got myself vaccinated last Tuesday, and I was actually very excited to go for the vaccination, and everything went so smoothly. We were like partying there because after the vaccination, you have to observe for 30 minutes. And then during the 30 minutes, everybody is like busy gathering, hee hee ha ha, because most of us also know each other, and because most of us are from the same hospital, or even not from the same hospital, most of us still know each other. Okay, we are mainly all frontliners. A lot of photo taking. Actually, it's quite a happy time taking the vaccination, and nothing actually happened to me. Many of you ask, any side effect? What happened? I got a lot of pain, and not pain when I'm getting the injection. When I had the injection, I didn't feel a little thing. I was like, vaccine go enter. I didn't feel the injection at all. I think the nurse who gave it to me was so expert. And also, I think the needle they used were really very fine. So I didn't feel any needle going into me, but I could feel the pain after that. It starts about 10 to 12 hours after that. At night, it was painful, it was swollen, and yeah, it was quite painful. For those of you who are pregnant and had your ATT injection before, you know it's like the tetanus injection. It does feel a bit of swelling and pain at night before I slept, but by the next day when I woke up or late in the morning, all the pain was over, no more. So it's just pain. Other than that, no big deal. Yeah. So just some pain, not very pain. I didn't require any hot pack, cold pack, or any painkiller. It's just slight pain, yeah, not too bad. Okay, let's go back to endometriosis. We have gone through so many videos now. We have a total of 5 videos. Most of them already uploaded in the YouTube channel. So for those of you who have missed the previous live videos, you can go to my YouTube channel, which is in the link below. Just click on to the link and then you go to my YouTube channel. Remember to subscribe to my YouTube channel, and then turn on the notification button so that every time there's a new video, you will be notified. So go ahead and look at the videos. There's so many videos on endometriosis uploaded already. Okay, so yep, let's see what the questions we have today. Let's not waste too much time because there's still quite a lot of questions, and I hope I can finish all your questions before the last session. Okay. Alright, let's see what question is this. Siti Khatijah Zaino asks, Doctor, I have period pain every month. I already done laparoscopy to find out if any endometriosis, but the result is okay. No endometriosis. After that, I still have period pain every month and take Panadol every month. Okay, so this is a very good question. First of all, I also want to know her age. If you're talking about young girls is quite common to have period pain. As I say, pain should go away with age. If let's say when somebody who was not that young, maybe in their 30s or 40s, when they tell me that they have period pain, my first question would be, is this period pain the same period pain you had all your life? If this is the same period pain you have all your life, that means it's not changing in any way. That means it's not increasing intensity, neither is it prolonging, or it's not going to different position. So if you don't understand, you want to know more about what is normal period pain, yes, go to my YouTube channel. I have one video on period pain, and I have a few definitions of what is normal period pain. So if that period pain is the same period pain for all your life as a teenager, it's not necessary you have endometriosis, because endometriosis is a progressive disease. So something is progressing, so there will be changes that happen over time, rather than it's the same when I'm 15, 25, 35, 45, still the same. That one is not endometriosis. Yeah. So but when you look at your laparoscopy, if it's normal, but you still take painkiller, because you take Panadol when you're having period pain. One of the criteria of abnormal period pain is when you need painkiller for your period pain. By right, you shouldn't need any painkiller for your period pain. So if in this type of situation, I would still think that there is it is still considered abnormal period pain. So that is why you have a laparoscopy done. So you saw no endometriosis. So my first question I would want to know is it really no endometriosis? Normally what I'll do is, if I see somebody like that, I want their videos so that I can have a look again, because I have seen videos where somebody told me that everything was normal, but when we look at it, there was actually endometriosis. Because you must understand, some endometriosis appear in many forms, and unless that doctor does endometriosis day in, day out, some gynaes whose special interest is not endometriosis, they can still miss the endometriosis, especially those who are deep-seated. So sometimes you can be fooled by the endometriosis. You look at it, it's all clear, but there's some little white patches here and there. You thought it's just white patches, because we're always looking for what do you call that, bluish or purplish patches or brownish patches, but then this is just white patches. And then when you actually dig inside, wow, you will see one big chunk of endo deep seated. The endo is so deep that outside is only white, but actually inside it's not white anymore. So sometimes it can be missed. That's one. And then of course we also know that if you look at my talk about our women hormones, if you are following all my videos, you will know that we always say that women hormone has got to do with what do you call that, when you have period, your hormones are a bit there's a lot of ups and downs, and just before your period your hormones are all down. So when our hormones change, we are also more susceptible to stress, whether it's an emotional stress, whether it's a mental stress. That's why women are more emotional during menses, right? So you're more susceptible to stress, and stress can cause period cramp also. So it can also be purely due to stress. I still remember I had this lady who had very bad period pain, so bad. It's not just the pain, she becomes so emotional that like everybody cannot tahan her, cannot stand her. She becomes so unreasonable during that time, and she used to go and see a psychiatrist because of that. She feels that she's having an extreme period pain, including emotional and character changes that happens only during period. So then they define as premenstrual dysphoric syndrome. So premenstrual dysphoric disorder is something that you will see a psychiatrist. So the psychiatrist give her some antipsychotic medicine to take just during menses to help her. But at the end of the day, what happened is that when she came and see my therapist, of course we also had a scope done for her to say that she has endometriosis. She also has some which I cleared off for her, but her endometriosis cannot explain her emotional changes and her extreme character changes during period. So that is why I still ask her, maybe why don't you try and see my therapist, and after see my therapist, settle, don't have all this problem anymore. If not, she still have that problem even after the laparoscopy. So that could be one of the things that you should need to consider, because not all period pain is due to endometriosis. Period pain can be due to stress. Like I also have one little girl who came and see me just a couple of months ago. She's just like 15, 16 years old, and the mother had no problem with period pain until like past 6 months to 1 year. She has so extreme period pain that she needed to go to hospital emergency department to get injection. So it's a bit abnormal. She's a bit too young for such extreme period pain. So I told the mom, I think it must be stress. And come to think of it, it's true, she said, because she changed school that year. And so I say, you better go and see my therapist. And same thing, change school, a lot of stress. Feedback from my therapist, there were a lot of stress in this girl. And yes, so sometimes when you think you are sending your children to a better school, but sometimes your children may not be able to cope being in a better school. you know, because the peers around her are so much high-end people, they may find it very precious. So that's her case. So that's why when she went and see my therapist, problem settled, period pain also settled. Okay. All right. Next question is by Carissa Yo. Carissa Yo asks, "Hi Dr. Tan, I have frozen pelvis on my right side. Do you think endo can cause it?" Of course, endo can cause it, because for frozen pelvis, there's only two possible causes. Two possible. It's either endometriosis or pelvic inflammatory disease. There's only two. So definitely endo can be a common, in fact, it is a very common cause of frozen pelvis. So what does it mean by frozen pelvis? For some of you may think frozen pelvis is when the entire pelvis is frozen, because what happens is, normally in normal situation, your uterus is free to move left, right, front, back. Okay, the tubes is also free to move, so they're going to catch the egg. The ovaries is also dangling down there, free to move. Everything is free to move. The bowel also can move here and there one. But in frozen pelvis, everything stick to each other. So your bowel and your uterus stick to each other. Your tube stick to your ovary stick to the bowel, to the ureter, to the muscle, to the bladder. Everything stick to each other. And because endometriosis is a very hard thing, so the thing that causes it to stick is endometriosis. And endometriosis is hard. So the thing that is sticking is hard. So can you imagine if you have a bunch of things, you stick them next to each other and use a hard glue, you know, that means this glue when dry up, it turns hard. So the whole thing, like a whole chunk of things, become hardened. So that's why we call it frozen pelvis. It's like frozen, you know, whole thing hardened and fixed, and there's nothing you can do. And it's actually very common with endometriosis. But honestly, why people use that word? It's very commonly used when people find the surgery difficult. In fact, quite sad sometimes when there are patients that go for a surgery. They know they have endometriosis. They go for a surgery, and then the doctor do the surgery, open up the tummy and say, "Oh, you have frozen pelvis." Then they close up the tummy. They did not do anything. They did not remove the endometriosis at all. They just close out everything. They didn't do anything, and then they tell patient, "It's a frozen pelvis. Surgery is too complicated and too high risk, so we cannot do anything." You ask me whether I've done that before? God, almost 20 years ago. Yes, that's what happened when you are junior. When you're junior, you're not skillful enough. You open up, you're scared, you don't know what to do, you don't want to take the chance, you don't want to take the risk, you just close back up. But honestly, to the patient, it is a very horrible thing to do, because she's suffering. Frozen pelvis, usually these women are suffering. They're suffering very, very badly. And you somehow open her tummy, you know, which is a major surgery, you know. And then the close back, you know, which should take 1 month to heal, and you didn't do anything. Oh my God. Most women cannot accept it, cannot accept it. So you ask me, I've done that before. Partly it's because I was attached to a small hospital at that time. I was like only gynae, no one else. And there's no ICU support. And I went in, I really do not know what to do. I called the general surgeon to come and say, Tana, so complicated, better don't do here, bring her to elsewhere. So like that lor. So very often, patients only hear the word frozen pelvis is when the doctor actually gave up on them. Gave up doing the surgery on that. And it is very common when you actually had your surgery done by doctors who are not skillful enough, not trained enough to do this surgery. So I don't blame the doctor. She's not trained. He or she is not trained. He or she is not skillful. If he insists to do the surgery for you, you may end up with a lot of complication. That's why I always describe to a lot of women that endometriosis surgery is the most difficult surgery to do in the world. So it's really the most difficult surgery to do in the world. When it comes to abdominal surgery, when you go in, open the tummy, endometriosis is the most complicated. So doctors need to be trained to do endometriosis. So not all gynaes are trained. When I was doing that surgery on that lady, I was already a qualified gynae. Probably 2 or 3 years experience, not too long. I was already a qualified gynae, but I'm still not trained to do endometriosis surgery. Thinking back, if today I get that case, I would nicely be able to do it. If with robotic, it will be so simple. Laparoscopic, still possible, but I will never do it as an open surgery. So that is why the doctor is very important. So sometimes when you have endometriosis, when you choose to do a surgery, but that doctor is not trained to do endo, then that's what happened. They will leave endometriosis on your bowel, on your ureter, on your bladder, and they say it's dangerous, better don't touch. But the only reason why it's dangerous is because he's not trained. Because you ask the bowel surgeon, no lah, cut bowel, no big deal, cut lor. Because he's trained to cut bowel. You ask the urologist will say, cut bladder, no, nothing, no big deal. Every day he cut bladder ma. Because he's trained to cut bladder. But gynaes who are not trained to cut bladder and not trained to cut bowel should not cut the bowel or should not cut the bladder because they are not trained. So that is why you need the gynae to be trained. Because if let's say you do not, the gynae is not trained, maybe the gynae asks the general surgeon, the bowel surgeon to come in. There's endo here, can you help me solve it? You know what the bowel surgeon will ask? What do you want me to do? Because endometriosis is not his field. But for a gynae who is trained, she will know. Sometimes I also call the bowel surgeon to come in. I say cut from this end to this end, take it away. I tell exactly where I want him to cut. Then he cuts it. But if you're not trained, if you're a bowel surgeon, he doesn't know. So he depends on the gynae to know what to do. So for me, bowel, I will still call, if I need to remove the bowel, if the endo is superficial on the bowel, I will do it myself. But if it's very deep-seated and need to remove the bowel, I will call my bowel surgeon, but I will tell him exactly where to cut. So that's why you need to depend on the gynae. Cannot depend on the bowel surgeon or the bladder surgeon because they do not know what you want, what is called enough for endometriosis. So that is why in frozen pelvis or endometriosis in general, ideally you should look for a gynae that is trained. And for those who are not trained, if they don't remove here and there, we don't expect them to do so because we know that they may cause more harm to you if they do not do it. Because when we attend all our training, all this while, I still remember, all these teachers that I see, whether in Bangkok or in France, say the same thing. If you are not trained and you are not confident, better you don't do. Close the surgery and send her to somewhere else that is able to do it. So that's supposed to be the way. Because in Malaysia, doctors who are trained to do endosurgery is less than 10. We have like hundreds of gynae, but only less than 10 is trained. So most of you will still have your endosurgery done by doctors who are not trained. So if they don't clear, it's not their fault because they also need to make sure that you are safe. They have to make sure you're safe. That is very important. And they also know that they also know that doctors who can do surgeries like yours is very limited. In fact, many years ago, not say many years ago, probably like 8-9 years ago, where I saw all these endo surgeries done in a workshop, I asked, who in Malaysia can do this thing? And that time, there was only one. And that is why I told myself, I must do it. Because then, at that time only I realized that actually the surgeon matter whether your endo come back or not. Whether after the surgery you still have pain or not. Whether after the surgery your endometriosis grow back again in the next couple of years. I also very frustrated because I also have a lot of patients that when I operate on them and then endo grow back, And you think about it, it's because my teachers teach me how to do it. It's like that only lor. Until I see how these overseas people do it, then only I realize that, yes, I am not actually doing the surgery the right way. And that is when I decided I'm going out of this country, because teachers in this country can't teach me. I'm leaving, I'm going overseas, I'm going to make sure I know how to do it. And it took me so many years to pick it up. Okay, so that is the scenario in Malaysia. But we don't like that, because we don't want. Honestly, if you ask me, I feel very sad. People already operate 2 times, 3 times, and you see there's still a cyst. You are very sad. I'm sad. So that's why I prefer, of course, you as a patient should always look for the gynae who can do endo surgery, who is actually trained to remove all endo. Not burn. Burn is no use. You need to remove. Like a couple of days back, I did one surgery for this girl. She had a surgery done last year only, last year. And after her surgery, her period pain is equally bad, if not worse. She feels that her pain is worse than before. And when I saw her report, the doctor wrote in the report that she burned. She burned all her endo. Then I told her, burn means it's still there. Because you can only burn superficial. There is still endo under. So when you burn the front, the cells will die, it will come off, it will shed off, and the endo that is deeper will now come in front. Still the same. So ZTZ asks, hi Dr. Tan, if pregnant with adenomyosis, can deliver normal or not? Okay. When pregnant with adenomyosis, it all depends on how much of adenomyosis you have. Okay, or whether you had surgery for your adenomyosis before. Normally, we say if you have adenomyosis, if you have especially quite a lot of adenomyosis, and you have done surgery for it, and you remove quite a big chunk, because you must understand that adenomyosis is a disease of the muscle of the uterus. So when we remove adenomyosis, we remove the muscle of the uterus. That means your uterus is no longer 100% already. No longer 100% intact. So if you have quite a big chunk of adenomyosis that was removed during the surgery, then we usually say no more natural birth. You need to have cesarean. That is the first thing. But let's say you didn't do surgery, you just got pregnant. Then again, it depends on how much of adenomyosis you have on your uterus. Is your uterus 100% adenomyosis? Or is your uterus only 20-30% adenomyosis? Why? The part of the uterus that has adenomyosis, the muscle is already hardened. Because when you want to give birth, you need the muscle of the uterus to squeeze the baby out. So if the muscle of the uterus already hardened, that part of the uterus cannot squeeze the baby out. So you depend on the other muscle that is healthy to squeeze the baby out. So at the end, it all depends on how much of adeno you have. If it's 100% adeno, it's very difficult. You can try. I have, because I am pro natural birth, so I usually give everyone a chance to try. And my experience with adenomyosis is, for those who have like almost 50% of the uterus with adenomyosis, even if you let them try, 90% of them will end up with cesarean. If your adenomyosis is less than 50%, there is still a high chance you can have natural birth. But if it's more than 50%, you can just try, but most of them, 9 out of 10 of them will end up with a cesarean. So I even had one lady, she could have a natural birth, difficult birth, prolonged birth, but it's fine. Delivered normally, we are happy. But the placenta cannot come out. Because once again, the uterus needs to squeeze the placenta out. And the placenta cannot come out. And normally when placenta cannot come out, we will put our hand in to take out the placenta. But it's so hard that was also not possible. At the end, she needed a surgery to take out the placenta. So, that was that one case that I will always remember. I will always remember this lady as well, okay? All right. So, depends on your adenomyosis, all right? So, let's see what's the next question. This is Marilyn Juliana. Okay, this question is from Marilyn Juliana. I have endo stage 2. I did 3 months Lucrin. After that, the pain came back. My doc recommend I take implant. It will help for 3 years. The pain gone now. So does the pain come after I take off the implant? Okay. When you have endometriosis and the pain is still there after surgery, and the pain go away with implant, the conclusion is very simple. That means your endometriosis is still there. That means the surgery was not a complete surgery. So you still have quite a significant amount of endometriosis still inside you. And as a result, you still have the pain. An implant, which is Implanon, is a progesterone-based implant. Progesterone is a medical treatment for endometriosis. So now you have endometriosis still left behind after your surgery, and you use medicine to control. So the pain went away. But we all know that medical treatment for endometriosis needs to be long-term until you menopause. Because even though it suppresses your endo, the key word is it suppresses, it does not remove. Your endos are all still there. They just become inactive, being suppressed by the implant. So if you remove your implant, your pain will come back. Maybe not instantly, maybe 3 months, 6 months down the line, the pain will come back. So that is why women on any form of progesterone to control endometriosis, you can never stop your medicine until you menopause. The only thing you can do is you can change. Why we change? Because some progesterone is not meant for lifelong. Like I saw this question, Olina Lee was asking about Noculot. Noculot cannot take forever. Visane cannot take forever. So that is why we need to change to a different progesterone that can be used forever. Implant, yes, it's safe to use long term. So if you are good on implant, my advice for you is to keep changing your implant every 3 years until you menopause. Then you will be pain-free and you do not need any more surgery for the rest of your life. So good that the implant worked for you. It's just that you need to continue it forever and ever until you menopause. Alright? So, yep. I think some of you who have listened to all my talks are now getting a bit more smarter and smarter. Maybe sometimes the questions you also know the answer. Next question is from Easy Ahmad. Easy asks, I get my period after started my Visane on the last month, and it has been 2 weeks since the menses started. Before I was on Lucrin for 3 months. Is that normal? Yes, because Visane does not stop menses forever. Visane is not like Lucrin. Lucrin act by really stopping your menses. That is why Lucrin, again, you cannot take longer than 6 months or 1 year if you're really desperate, not more than 1 year. But for Visane, it is not, it can take longer, it can take 3 years. So that is why Visane actually can still have some amount of menses, which is normal. Siti Zubaida asks, hi doctor, if menses still come after Lucrin, periods still come every month, does that mean that endo is very bad and nothing we can do? No, it has nothing to do with your endo. Lucrin, if it works on you, it should stop the period. If your period never stopped, means the Lucrin didn't work. So it's not the endo that is bad, but the Lucrin didn't work. So your body and Lucrin maybe had some issues. Your body cannot accept Lucrin so easily. So Nothing to do with endo, you just probably need to change to a different medication. Shafika asks, Doctor, I'm 33 years old. I already have 2 surgery before, and next month will be my 3rd surgery. I have no idea when will this end. How many surgery do I need to go through in the future? I feel really down thinking about it. I think for all of you who have been listening to my video, you know the answer to this question. The reason why she keep going for multiple surgeries is because she did not get the complete endometriosis treatment. So for those of you who are new in this live video, if you want to know what is a complete endometriosis treatment, please go back to my previous videos and you'll understand more. As I always say, number 1, your surgery need to be complete. So you cannot be just doing the surgery by any gynae. You need your surgery to be done by gynaes trained in endometriosis, and ideally it should be done robotic. Okay, never open surgery. Ideally should be robotic. Compromise a bit, that will be laparoscopy, but it's still not any laparoscopy or any robotic. Still need to be a doctor that is trained in endometriosis surgery. Number 2, any long-term maintenance medical treatment after the surgery. So normally it's because you have no maintenance treatment, that's why your endo will come back. Just like the previous case, the moment she took implanon, she's fine, you see. So you need long-term maintenance treatment depending on the severity of your disease and how much the doctor has been able to clear. If your doctor did not clear fully, maintenance treatment is definitely a must. But if let's say the doctor cleared 100%, you still need preventive treatment. Okay, so 3rd is you need to also go for dietary changes to control your endometriosis, to make sure endometriosis doesn't come back, which I mentioned earlier. Low estrogen, high progesterone diet. Number 4, you need to see a physiotherapist to relax back all the muscles that are involved in the pain that is caused by endometriosis. And last of all, you also need to see a psychological therapist to solve all your stress problem, because stress itself makes endometriosis comes back. So if you don't go through a complete endometriosis treatment, then endometriosis high chance will come back, and that's why you keep getting repeated surgery. For me, my aim is I don't want people to go for more than 1 surgery. That's why I always emphasize to all my patients after the endometriosis surgery is you must take care. You cannot ignore this disease as long as you are not menopause. Endometriosis is a long-term illness. It's not a short-term illness. So it is like a heart disease. You have to take care forever. If not, your heart attack will come back. So it is a long-term disease. So you need to take care until you menopause. Only when you menopause does it go away. Okay? Okay, next question is Susan Eng. Susan Eng asks, my friend having left ovary stuck behind uterus. She has adenomyosis too. Is this surgery, does the surgery can help to remove ovary to its original position? Okay, let me explain a bit about endometriosis surgery. Actually, in all endometriosis surgery, we have 2 purposes. Number 1, we want to clear all the endometriosis. Yes, that's the first thing, our first aim. Second aim is to return everything back to where it's supposed to be. So like in this case, if you do a surgery by a doctor that aims to clear all your endometriosis, or I would say trained to clear all your endometriosis, then the ovary will definitely go back to where it's supposed to be. Because the only reason why the ovary is stuck behind the uterus is because of endometriosis. So if you clear the endometriosis between the ovary and the uterus, then of course the ovary and the uterus will be separated already. Okay, so ultimately, again, once and again, I want to emphasize the importance of being operated by endometriosis trained gynae. Cindy Heng asks, I did open surgery for acute and perforated appendicitis 1.5 years ago, and doc told me that I have endometriosis stage 4, but I don't have pain during period unless I take cold food before period. Only I will have pain. May I know what is your opinion? Okay, it is very simple. Not all endometriosis cause pain. That is why a lot of women with stage 4 endometriosis, they don't have period pain, but they may have other symptoms. Yeah, like today I have one lady. She came and see me just because she cannot get pregnant for 2 years. And as I mentioned in my very first video, we in our clinic, we do deep endo scan. So when for fertility cases, we will do deep endo scan because we want to know if you have endometriosis. Because if you do a normal ultrasound scan, you can miss endometriosis. So in this case, I did a deep endo scan for her. So when we do a deep endo scan, and once again, you can't find deep endo scan everywhere. So again, it is still doctors with special interest in endometriosis. They are the ones who will bother to do a deep endo scan because it's something relatively new. In the world, maybe about 5 years. So only if we actually bother to go overseas to learn. In Malaysia, I've not seen anybody running courses or workshops to teach people how to do deep endo scan. So for doctors who actually bother to learn, then only we know how to do it. So in our clinic, we do it. And in this lady, she has deep endo. When she did her deep endo scan, she does have deep endo. But when you ask her, do you have period pain? Don't have. But when you ask more, during period, do you have diarrhea? They say, yeah lah, I do have lah. During period, does your do you urinate more frequent? Oh yeah lah. Do you have backache? Yeah lah. Do you have tummy bloated during period? Yeah lah. She has all the symptoms of endometriosis, just that she doesn't have period pain. Okay, but she does have ovulation pain too. And pain during ovulation is again endometriosis. So you see, you may not have period pain, but you have some other symptoms of endometriosis. Because we know that endometriosis at a different location causes different pain. For those who have very bad period pain, they need to have endometriosis usually at the nerve. Not in the ovary, you know. Not in the ovary, it's usually in the nerve. In the uterus, if you have just simple adenomyosis, also not necessarily have pain at all. But some people, they develop chocolate cysts within the uterus. Whenever we say chocolate cyst, we always think about ovary. That's where it is. But chocolate cyst in the ovary does not cause pain at all. But chocolate cyst in the uterus is very painful. So that's why when you have a normal ultrasound scan, not a deep endo scan, just a normal ultrasound scan, you see chocolate cyst and you have so bad period pain, we already know your endometriosis is not just in your ovary. Because chocolate cyst in ovary has no pain. Many times I see very typical cases. They will tell me period pain on the right side, but the cyst is on the left side. Because the cyst does not cause pain. The pain is due to the endometriosis at the nerve. That is the one that's very painful. But not everybody will have endometriosis at the nerve. So that's why you don't have very bad period pain. If you talk about backache, around the kidney region, there is endometriosis that is affecting your urinary tract. So that can be actually quite a dangerous situation because you can lose your kidneys. Okay, so whatever it is for Cindy, you have stage 4 endometriosis. I hope you do something about it and don't let it keep spreading and keep progressing and keep worsening until one day you actually have period pain. And this is again a very typical thing. We tend to see a lot of women to come to us as stage 4 endometriosis, and they will tell you, I have period pain only the last 6 months. Endometriosis 6 months, so bad? Impossible. So they have endometriosis all through the years, probably for more than 10 years, since they were young. It's just that it did not cause any endometriosis at the nerve, so she has no pain. But if you really sit down and talk to her about all other symptoms of endometriosis, you'll find that she does have others. But to her, those are normal. Now it's very pain. That's why only she can't see doctor. But actually the endometriosis has been there for a long time. Why now only she feels very pain? It's because finally the endometriosis has gone to her nerve. So that is why she starts to feel very bad pain. Azlim Almi say, hey doctor, I had endo surgery done last year, now still on Lucrin. During checkup, doc said that my ovary attached back to the uterus. What should I do? How would I describe? I would say this way. We want to know why the ovary attached back to the uterus. So number one, the doctor must have removed it, must have separated it, the fact that it said that attached back to the uterus. So doctor must have done something to remove it, so to separate it. But what happens is, even after separate, there is a tendency of going back. One of the ways to prevent that is to put gel, adhesion barriers, we call it adhesion barriers, so they don't stick back. They do not allow it to stick back, so it's adhesion barriers. Question number one I would want to know is whether the doctor did put, because we know that if you put, then even if it stick back, it is usually not stick hard, you know, it's usually a much softer type of attachment rather than a hard attachment, or it should not actually literally stick back. It should be still separated, but maybe it's just at the location. But okay, what if it actually stick back? What should you do? That actually the question all depends. I will have a question for Aslim. What is her main problem? Is it pain? Is it pregnancy? Is it just the disease or is it pregnancy? If it's just a disease, all women after endometriosis surgery need to be on maintenance treatment. So same, you just need to be on maintenance treatment. There's no problem having the ovary behind the uterus, no issue. But is it because of something else, like you're trying to get pregnant and this ovary stuck is affecting you? Then it's okay, you have two ovaries. As long as the criteria number one, your endometriosis is totally removed. If your endometriosis is totally removed, you only need one ovary to get pregnant. You don't need two. So it's fine. Because most of the time, the ovaries that get stuck is usually only one. Ivy asks, Ivy Caneso Villa. I think must be a Filipino. Ivy asks, is it normal to feel pain even though taking Cerazette for more than a year already? Okay, Cerazette is a progesterone. Of course, it is one of the maintenance therapy for endometriosis. But Cerazette is also a birth control. Yeah? It's also a birth control pill, but it's a progesterone only birth control pill. But among all the progesterones that you want to use to prevent endometriosis from coming back, Cerazette is definitely the weaker ones. So you won't be able to see the effect so fast. So if you're still in pain, I will advise you, Ivy, to switch to something stronger. Like Mirena. I love Mirena because Mirena is a lot more effective and it has very, very little side effect. Let's see what's the next question. This question is from Pang Fui Mi. This is quite a recent question, which was last week. Pang Fui Mi asks, no, I think she mentioned something. Some women will reject or avoid surgery or any medication but take natural health remedies like supplement. Their cysts getting smaller or even disappear. Are there any chance that their cyst is progressing or affect fertility even when doctors said their cysts are gone? There are many possible scenarios here. I have seen, first of all, we want to know whether, because she mentioned cysts, my question is it endometriotic cyst? Because you need to understand that endometriosis, a lot of cysts in this world, not all are endometriosis. And to be typical understand, there is also two types of blood cysts. One type of blood cyst is endometriosis, which all of us know. The other type of blood cyst actually is we call hemorrhagic corpus luteal cyst, which is again a blood cyst. If you have a blood cyst that disappeared so fast, like after 2 to 3 months, then I don't think it is endometriosis to start off with. Because endometriosis, even if with treatment, medical treatment, it shrinks very slowly. If it disappears quite fast, then I would still think that most likely it is, hemorrhagic corpus luteal cyst. That one can go away in 2-3 months. But are there women that do not take any medication or surgery and yet their endometriosis shrink? Of course there are. You see, in my complete treatment, I always say there are 5 things. Some people, their cyst is not so bad. They may not go for surgery. But you go for, medical treatment, let's say. Take medication like Vicane. Your cyst also will shrink. But we know whether Vicane or even getting pregnant, the cyst will shrink. But even if it shrinks and become not active, the cyst is actually, the roots are all still there. That is why even when you stop, it will come back. You look at those people who get pregnant and then there's no more cyst after they give birth. When the baby is about 2-3 years old, the cyst comes back because the root is still there. That's why those of you who have already had surgery done, got pregnant, don't ever forget to go back on maintenance treatment. And we also have what I mentioned earlier, the other 3 aspects. Maybe not so much when it comes to physiotherapy, is more for pain relief, but dietary changes as well as stress management also can affect the growth of your cyst and also can affect your cyst to shrink. Definitely. I think I've mentioned, if you went through my video, I had one lady with a 12 centimeter adenomyosis who refused medication and refused surgery. All she did was to see my therapist 4 times to do some counseling and stress management. Her adenomyosis from 12 centimeter within 4 months became 8 centimeters. I mentioned this case in my earlier videos. So it's possible. It's definitely possible. But it is not that easy to do. To be on strict diet, low estrogen, high progesterone diet until you menopause, it's not easy to do. Because, food, as far as food, we have cravings. How many of us go on diet and put on weight? You see, it's all because we can't control ourselves long term. We can control short term, but we cannot control long term. So at one point when you start to give up on your diet, that is when your cyst will come back. Same with stress management. Of course, same thing. Stress management, you go and see the therapist for a few times, your stress level will come down. But whenever something happens, maybe like a pandemic or you lose your job, it comes back up. Then your cyst comes back. So again, it can, definitely can. All this, we call it endometriosis complementary therapy. That's what I call. I put most of my patients nowadays after surgery on endometriosis complementary therapy. To me, it's a complementary. I do a surgery to remove the disease. So when your disease is removed, then there's no more root. We still need complementary therapies because we know that endometriosis can still come back. We want to make sure that the endometriosis got no chance in coming back. So we treat from every aspect possible. I had this one lady, I still remember, she had a 4 centimeter cyst. And she didn't want surgery, she didn't want medication, she don't like to eat medicine. So after some time, her cyst actually disappeared. But she still had one problem, she couldn't conceive. Cyst is gone, but she still couldn't conceive. So finally, she still said, okay, let's go and do surgery. And when we went and do surgery, the endometriosis was still quite bad. It's only the cyst shrink, or I would say maybe, I don't know exactly what happened. It did shrink or what. I remember seeing the cyst and then after that I didn't see the cyst again. So, but when we did the surgery, the endometriosis was still quite bad. She was still about stage 3 to 4. So I don't know how her cyst disappeared, but one thing I know, she still have endometriosis. Because We know that even with pregnancy, no menses, even with Visane and Lucrine, they all come back if you stop it. So even if you do supplementary stick supplement, I'm sure there's a lot of high progesterone supplements out there, but it is again the same. It's temporary. Okay, so and she asks, are there any chance that their cyst is progressing or affect fertility? Okay, infertility is a different story altogether. There are two aspects in what way endometriosis affect fertility. One way is the toxic effect that I mentioned in some of my videos. Because endometriosis has a toxic effect. I haven't actually mentioned in detail how endometriosis affect fertility in this series, but one of my older videos. It is actually a toxic effect because endometriosis secretes certain chemicals, and we know all these chemicals actually causes the egg quality to be bad, kills sperm, it kills the embryo as well. If you're doing IVF, it just kills everything because it's toxic. But there's another aspect that it affects fertility, is all these adhesions. I told you the things stick to each other, where the ovary stick to the uterus, stick to the tube, stick to the bowel and everything. So when you have all these things sticking to each other, things cannot function anymore because you need a free to move tube to go and catch the egg. To catch the egg. So if your tube is not free, it's stuck, how is it going to catch the egg? So that is why if you go on treatment like Visane or even complementary treatment like dietary changes, supplements and stress management, your disease can be not active anymore, but whatever stick to each other still stick to each other. In fact, the sticking, there's no other ways except surgery. That's why when women tell me that they can't get pregnant, if their problem is because they have endometriosis and they cannot get pregnant, the only answer is surgery. Because whatever medication you take, number one is temporary. Medication that you take do not allow you to get pregnant. And even if you suppress the disease and you're able to get pregnant, but everything sticks to each other, how to get pregnant? Yes, you can do IVF for that, but IVF is not 100%. So like, let's say if I do this month, I do IVF and I'm not pregnant, then what happens next month? So it still boils down to surgery. Women should not depend on IVF for pregnancy. You should still heal yourself and solve all the problems related to fertility, even if you want to do IVF. Because IVF is not always successful. So you still need to have your backup plan, I don't mind doing IVF, but you must have your backup plan. Because what if your IVF is not successful? Then what's your backup plan? You leave your endometriosis there, how are you going to get pregnant? Okay. Alright, so last question. Doctor, I consumed Visane before and currently I'm 8 months pregnant. Should I continue Visane after delivery? I plan to breastfeed my baby and to have another baby in 2 years. Honey, it's good that you know that you need to be on something after you give birth. Luckily, and you're not going to leave it on its own. But of course, you cannot take Visane after that. So normally, if let's say you give birth, we also do not need you to go on Visane, because pregnancy itself cures endo, suppresses endo very effectively. So what you need more is a maintenance prevention therapy. It's more preventive now after this. So you can go on Mirena. I always say Mirena is good. Implanon, if you prefer Implanon. Cerazette, like what Ivy had, is also possible, but it's not so strong. Recently, I had one lady, I operated on her and she got pregnant after the surgery. When I did her surgery, it was her second surgery. Her first surgery was somewhere else. After the surgery, she was still in pain. So within 1 year, she saw me and we did the second surgery, and then she's pain-free and she conceived quite easily, actually. She conceived twice. She conceived first time miscarriage, and after another 2-3 months, she conceived again. So easy to pregnant after that. And then she gave birth already, and now her period came back. She started to worry that her endometriosis would come back. when I say Mirina, she said don't want lah, something go in from below. Then I say implant, no, I don't want anything that poke me. So she took Cerazette. I mean, Cerazette is better than not taking anything lah. Okay, it's still okay. And for her, I'm quite happy for her to be on Cerazette is because her endo I have totally cleared, and she's so fertile after that. So I'm quite confident her disease is very well cleared. So you do not need such a strong one. So Cerazette may be enough. But if someone that is not really sure whether your endometriosis is totally cleared, then probably it's still better to choose either Implanon or Mirena. Mirena is stronger than Implanon. So for all of you who have missed some of my previous videos and certain things when I mentioned you probably still do not know much about it, do go to my YouTube channel. Yeah, my YouTube channel, the link is on this post, and just click onto the link, subscribe to my YouTube channel, and click onto the new notification button. Go through all my endometriosis videos I have in this series, already 5. Today is number 6, and before that I also have other endometriosis videos as well. It's good to go through all of them because every video I will mention slightly different things, and this time it's more updated, and as we go along there will be more and more updates. End of this month I am actually attending a online endometriosis conference that is held in US. I'll be attending it, and I will be having some more infos definitely. And incidentally, they also have this workshop at this conference in the month of Endometriosis Awareness Month, so that whenever you have new info on endometriosis, new videos on endometriosis, you will be notified by your phone. And if you have any questions you want to ask me about endometriosis, do put it in the comment section. Yeah, I have 2 more videos to go. Hopefully I can cover all your questions in the next 2 videos. Yeah, so do put it in because next month is cesarean section, cesarean awareness month, and everybody knows that I am a pro natural birth, which is more towards cesarean prevention. So definitely I'm going to make use of next month to talk or give you all what do you call that, more and more knowledge on cesarean prevention. Yeah, so that's all for tonight. See you again next week, same day, same time. Bye.